Bonjour to all. Ankylosing spondylitis is genetic, chronic, multisystem inflammatory autoimmune arthritis that affects males more than females. It's a disease of young between 20 to 40 years of age. It does not affect the blacks commonly, but when it does, it is severe. The risk factors for developing ankylosing spondylitis are family history, psoriasis, Crohn's disease, ulcerative colitis. There are supposedly 60 underlying mutated genes, but the most frequent occurrence is with HLA-B27. Surprisingly, not everyone with HLA-B27 is doomed to have ankylosing spondylitis. Keep in mind, it's an arthritis of inactivity that gets relieved on movement. In more recent times, it has also been termed axial spondyloarthritis. The most significant finding is fused vertebrae, and that is what ankylosis stands for, leading to bamboo spine. The most affected joint is sacroiliac joint, that is where pelvis meets the hips. The modified New York criteria is often used in clinical research and practice to diagnose it. It incorporates one positive clinical feature and radiographic finding. The complications of ankylosing spondylitis are kyphosis, fractured spine, osteoporosis, uveitis, amyloidosis, restrictive lung disease, aortitis, arrhythmia, nerve damage, and cardiomyopathy. The lab usually comprises of inflammatory markers, chest X-ray, CT, or MRI. The treatment is medical or surgical. NSAIDs, COX-2 inhibitors, DMARDs, biologics, Janus kinase inhibitors, interleukin 17 inhibitors, steroids, joint replacements or laminectomy or exercises or physiotherapy and healthy diet can all be employed depending on the case. The main differential diagnosis is with a slip disc in which there is an acute onset, whereas in ankylosing spondylitis, it is an insidious onset with symptoms usually lasting for more than 3 months. Reach out for a dog if you have low back or buttock pain that comes on slowly, is worse in morning or wakes you up in the second half of night, particularly if this pain improves with exercise. The latest research is on finding newer mutated genes and alterations in the microbiome. Don't forget to keep me, my family, and my friends in your prayers.